So what about when we talk about hormone replacement, when we do bring that in? So if a woman is living with diabetes, we're still living with diabetes. So that's another whole
Yeah.
part of this equation.
Right, right.
And one of the symptoms that you ran off a lot of the same symptoms, and you did already point to the fact that thyroid does impact insulin sensitivity, and that's one of her biggest things that she was suffering with. Is she was more resistant, needing more insulin. So again, it's all in the same basket, really, and it's sad to say it's so to the point, but I think once we know, it does help understand it. So what happens if you are, let's say, you've been on treatment for thyroid for years, although we don't know, listeners, or maybe some examples that we've talked about today, what sort of treatment that they are using. They might still only be on the levothyroxine, the T4, and then they bring on estrogen, progesterone, maybe even testosterone. And because I have seen studies, and then, I've seen it written where your thyroid is something you need to keep an eye on even more once you bring in those other hormones. Again, the TSH is the one thing they're looking at, even though you say it's not as important, but that's that one marker that does start to climb up once they bring in the estrogen. So are you seeing evidence of that? Is that something that they need to consider or their doctors need to consider?
Yes and no. So
Okay.
if we unpack that, when you bring in estrogen, number one, it depends on the delivery method of that
Delivery method.
HRT. So
Okay.
we personally do not ever use oral estrogen.
Mhm.
We find that increases risk of blood clots, and it increases something called thyroid-binding globulin. It also increases sex hormone-binding globulin. So oral estrogen is notorious for that as birth control. So if we're using the patch or a cream, which is standard of what we use for hormone replacement, bioidentical hormone replacement, we're using it at a dose to bring her estradiol level into that optimal range where she has the bone, brain, breast, and heart protection and symptom relief, but we're not taking it to a level that's going to increase her thyroid binding globulin, which will then come back and impact thyroid hormone because it will bind to the free T4 and T3 and bring those down. Now, if we're managing her thyroid at the same time and we see a little decline in those hormones and she reports the symptoms associated with the decline, we just adjust her dose. If
Yeah.
she's over
Yeah.
here feeling amazing and her estradiol is a 120 and she's, living her best life, but we see her free T3 start to drop over here, just increase her dose of T3, make sure that it's
Gotcha.
tolerated, make sure that that
Okay.
improves, the numbers in her symptoms and all as well. So it's really not something that you have to be overly concerned about
Okay.
unless, of course, you're on birth control or oral estrogen. And I even talk about birth control in the book too.
Okay.
And I say, like, listen, if you're in midlife and you're using birth control, it's time to stop because we got to find a different method of protection. Birth control just has too many side effects. It increases your risk of hypothyroidism. It increases SHBG. It just has a host of issues to it. Now, if you're in your 20s, your 30s, you don't want to I get it. I get it. Use the birth control during that time. But once, we grow up and we're in a monogamous relationship or whatever, let's figure out a different way because that
Yeah.
oral birth control just wreaks havoc with your body.
Yeah, yeah, that's a really good reminder. So what kind of, because I know that you're big on lifestyle. So what are the things you mentioned it here just a minute ago? Reducing stress, sleep, protein, nutrients, movement, all the things, and obviously inflammation. Gosh, that's a hot word, isn't it?
It is. It is.
Yeah, but we know I love the word terrain. We got to protect the terrain. We got to keep that foundation the best we can. It helps everything. And obviously, when we're bringing in hormones, whether it's thyroid, sex, the sex hormones, and insulin, of course, is a hormone, all of these things, it does optimize everything. So it's really setting down that kind of that base, isn't it?
It is. And, I always say we can't put hormones on a dumpster fire. So you have to build that foundation so that when we bring in those beautiful life-giving hormones, they do their job. And they do it to the fullest and they do their best job. So yes, that baseline lifestyle foundation that we all talk about, it really is key.